Good morning everyone. I am Mrs. Deepika from the Department of Vision Assistant in Allied Health Sciences. Today I am going to explain about the topic in pathology systemic condition myocarditis. Myocarditis it is the cardiac condition which leads to inflammation of the heart muscles. It is called myocarditis. Introduction of myocarditis. Inflammation of the middle layer of the heart valve. Myocarditis is usually caused by a viral infection. A severe cases can weaken the heart, which can lead to heart failure, abnormal heartbeat, and sudden heart death also. And etiology, some of the causes which leads to myocarditis. In that cases we can see alcoholism, drug induced, lead, spider bite, wasp setting, snake bites, chemotherapy, or radiation therapy. These are some of the causes which leads to myocarditis, that means inflammation of the muscle in the heart. And then pathophysiology. In pathophysiology, due to any cause which leads to viral infection, if it is in case of viral infection, the viral infection which leads to persistence of virus, which leads to myocardial dysfunctions, which leads to dilated cardiomyopathy. In other case, due to any cause which leads to genetic mutation. The genetic mutations which leads to structural protein absence, which leads to myocardial disinfarction, which leads to as usual dilated myocarditis. These are the two steps the pathophysiology will get worsened. And then we are going to see about signs and symptoms. Shortness of breath, abnormal heart rate, a sharp or stabbing chest pain or pressure which may reduce to your neck and shoulder, fatigue. These are the symptoms. And signs: fever, muscle ache, sore throat, headache, and diarrhea. And then complication in heart failure, heart attack or stroke, arrhythmias, sudden cardiac arrest. These are the complications for myocarditis. And then we are moving to diagnosis. In diagnosis, history collection and physical examinations, and lab diagnosis are blood test. In that blood culture also we used to do to check infections or to rule out the specific microorganisms, and also biomarkers also will get elevated in this myocarditis, so we can check out the biomarkers. And then chest x-ray to rule out size of the heart, and electrocardiogram means ECG to use the record of the rhythm, and ultrasound echocardiogram to make an image of the heart and its structure, and CT, MRI, and angiogram, catheterization and all if need. Patient can undergo these procedures. In cardiac catheterization and heart muscle biopsy is the two important test. A thin tube catheter throughout the blood vessel in an arm or growing to an artery in the heart. Dye flow throughout the catheter to help the heart artery show up more clear on X-rays. A tiny sample of heart muscle tissues may be taken during this test. The sample is sent to the lab to be checked for inflammation or infections. And we are moved to medical management. In medical management, ACE inhibitors like captopril, enalapril, lisinopril are used to relax of blood vessels and decrease the blood volume, which leads to lower blood pressure and decreased oxygen demand from the heart. And beta blockers like atenolol, propranolol, bitalolol to manage abnormal heart rhythm and to protect the heart from the second heart attack after the first heart attack. And diuretics increase the excretion of the urine from body. Long-acting loop diuretic reduces the progressive of myocarditis to dilate cardiomyopathy. And antiarrhythmic drugs like disopyramids, flecainide, mesilitine used to suppress abnormal fast rhythm such as atrial fibrillation, supraventricular tachycardia, and ventricular tachycardia. And corticosteroids. Corticosteroids suppress the immune system. They may be used to treat some rare type of viral myocarditis such as giant cell and eosinophilic myocarditis. And then we are moving to surgical management. In surgical management, some of the procedures are mentioned here. First one is ventricular assistant device, VAD. The VAD helps pump blood from lower chamber of the heart to the rest of the body. It treats for the weakened heart. Second thing is intra-aortic balloon pump. In this device helps increase blood flow and lower the strain on the heart. To insert the thin tube into the blood vessels and the leg and the guide wire to the heart, the balloon attached to the end of the catheter inflates and deflates in the main artery, leading out the body from the heart. This is intra-aortic pump. And ECMO and heart transplant. In ECMO, extracorporeal membrane oxygenation. An ECMO machine works like a lung. It removes carbon dioxide and adds oxygen to the blood. If the patient have severe heart failure, the device can send oxygen to the body. Last chance, heart transplant. An urgent heart transplant may be need for very severe myocarditis. And some of the conservative managements also there, like lifestyle modifications, in that salt restrictions, avoid or limit alcohol, cessation of smoke, to avoid competitive sport for the at least 3 to 6 months after the procedure. Thank you all.